My experience in diving, in the diving world, I trained in hyperbaric in the early 90s in Detroit. At that time, we had the only hyperbaric chamber in the city. We're doing all the Great Lake dives. In Danbury, every puddle, stream, a lake, they have a public safety dive team. So I'm guessing over 1,000 public safety divers in Connecticut. None of them are getting adequate medical care. And it's sort of my mission in life to, be their medical control, if you will, and try and give them, education, training, safety, and guidelines and recommendations in public safety and public safety diving. There is a topic that's important, which is children in diving. The only conflict I have or disclosure is I have 2 children. Boy, are there some conflicts, but none with pharmaceutical companies or other operations. Now, I'm going to approach this as a diving physician. So I get calls all the time. I get consultations, evaluations, and questions by parents and also a lot of the local dive shops. So I'm going to take you through a 20-minute discussion of some of those questions, which I think are very common. And the first one, of course, is can my child dive? How young is too young? What are the medical risks for diving in children? Is my child at greater risk or lesser risk for a diving injury than an adult? And what are the treatment options for an injured diver? So we can see that there's a whole breadth and spectrum of children in diving. And if you're in Pampers, I would say that would be a contraindication to diving. If you have certain underlying issues like attention deficit disorder, and you have to have your instructor tethered to you because your impulse is to continue to go and shoot off like a rocket, even though you may be only 20 feet from your boat, this can be a very dangerous situation. So when we try and look at the question of what is the optimal age to dive, I think if you were a dive instructor, you'd be very comfortable with a group of adolescents, young adults who could actually understand and fathom the issues of safety, direction, and cooperation and teamwork. If we look at the guidelines and recommendations of some of the United States swimming associations, diving associations, the Professional Association of Diving Instructors, PADI, they start training or trying to encourage kids to be in their pool at 8. And they have these pool-only experiences more because they want to, it's a market share. They want to be able to get these children in to satisfy the quest for the parents to be able to dive with their kids. So when you're 10 is when they actually start certifying you to dive. So age 10 under PADI. And it's somewhat restricted in that once you're a certified junior open water diver through PADI, you have to always be accompanied with a buddy who is either a PADI professional or a certified parent or guardian. And that's great, except if you get lost, separated, which happens to all of us at our very attempt of being a buddy. They have restrictions on depth, which is 40 feet, and then a little less of a restriction between 12 and 14. And if you look at the National Association of Underwater Instructors, NAUI, they have a similar kind of thing, a pool-only snorkeling program with no age limitation. And then at 10, they start giving junior scuba programs where you're in water. And then the Scuba Schools International SSI, they have a similar pools-only program, but it's basically at the age of 10. So the first question when a parent says, how old can my child start to dive, is typically 10 in the United States. And if you look at and ask the question, well, how many divers are there in the United States that are of the pediatric age? Between 1% and 10% of all scuba divers are in the United States. And the problem is that there's no national registry or database, so that number can be varied. It may be significantly higher or probably lower. We don't know. The majority age is between 12 and 17, and less than 2% of all divers in the United States are younger than 12. And the real question is, for those of us who are physicians, we know that when we take care of children, we know that you can't treat a child as a little adult. They have different physiology, growth and development. All the medications are weight-based. There's a science and a specialty in pediatrics. And that really has to be universally applied. It doesn't matter whether you're diving or you're in the emergency room getting antibiotics for pneumonia, for example. We have to have a clear understanding of growth and development. And I would have to say that the training in growth and development for most dive shops are about 0, right? Anatomy and physiology vary in children. It's age-related, right? The physiology of that child in Pampers is going to be a lot different as that adolescent who's 14 to 16 years old. And we universally apply adult fitness recommendations to dive to children, but that necessarily isn't the best thing for children if we understand that there are distinct differences. And there are statements floating around which allow the industry to market themselves to the younger crowd. And this was in the PADI Undersea Journal that said there is insufficient information available to make an evidence-based medical judgment for or against children scuba diving. So this is something that a lot of the industry uses to say that it's okay to have a young child because there's nothing in the literature that says it's dangerous or forbidden. As a diving physician, when I'm asked, can my child dive or can I dive as an adult, I have to ask 5 basic questions. What is your risk for losing consciousness? What is your risk for maintaining your orientation? Do you have an issue with panic reactions? How do you handle that? What's your risk for barotrauma? And what is your psychological fitness? These are sort of the 5 things in the back of my mind I have to ask when I'm going to evaluate whether it's a child or an adult. And when we look at that age, when they started diving at 8, where did that 8 come from? It's sort of an arbitrary number. But if you start looking at developmentally, children start to, at the age of 8, have psychological and sensorimotor development, which will allow them to have things like teamwork, logic and reasoning, risk awareness, concentration, and focus. And I can tell you that my 14-year-old is not there yet. So just because it says at 8 you're developmentally okay to start developing that, it may take you many years. And some of my adult dive buddies, friends in the world, they still haven't made that list yet. Okay? And when we think about the conflict of interest between the various diving agencies that want to market to the younger crowd for financial gain, we have to think about where does that tie into what is actually safe. Let's talk about some of the general fitness differences between children and adults. A big issue on the physical development part is heat loss. And there's a significant disparity between adults and children between the body surface and the body mass ratio. It's about 1.5 times greater than in adults. And that leads to an increased accelerated heat loss. So they become more prone to hypothermia at what you would consider as an adult pretty good temperatures. So I'm in my 6 mil suit, I'm doing okay, and suddenly you have a child who is shivering and not following commands anymore because they're hypothermic. And if we look at the forefathers of diving medicine, Paul Burt, what he postulated and believed was bubbles cause decompression sickness, and Haldane, decompression sickness would not occur if bubbles could be avoided. Makes sense. That's what we live in and die by here. Hopefully not die. And Divers Alert Network, when you were at the DCI workshop last night and Nick Bird was talking about the probabilistic aspects of decompression sickness, so the probability of you getting bent while sitting in this room is 0. But once you put fins on and go underwater and you start onloading and offloading gases and you have nitrogen bubbles circulating and percolating, right? You have that risk of getting bent. So what are those factors in children? And if we think about the risk in children for acquiring bubbles, we always are concerned about the aspects of how it will affect their growth plates. And for the non-physicians in the room, I will show you this. Here we go. So what I have here, basically, these are what called growth plates. These allow the bones to grow. So you're born with, this is your tibia and fibula, so that's the lower shin bones. And as I'm growing and developing, this growth plate has a neurovascular bundles, which has a very robust blood supply that brings a nutrient nutrients to the air which allow the bones to elongate. And then once I'm in my mid to late adolescence, these long bones, the plates fuse and I no longer grow. So if I have any damage that occurs when I'm younger, so I have a fracture or broken bone here that disrupts this, I potentially can affect my ability to grow. So if I have a fracture to this side on my left leg and it's not managed properly, I may have a short leg, for example, disparate to the other side. And this is a cross section, so I cut across here, put it under the microscope, so you can really see what the issues are with an epiphyseal plate, a growth plate, and a growth plate injury. So you can kind of see here is that growth plate, right? And here are that very robust blood supply. So if I fracture it or break it, you can see there's disruption there. If that's not properly healing, I can have a problem. What would be the variables and what would occur if I had nitrogen bubbles there? Could that affect growth plates in children? And you can see here, right, across, this is a child, right, and here is an adult where it's fused. So you can see the difference and understand what the potential issues are with bubble disease and bones. Let's talk about barotrauma, okay? Barotrauma is another part, right? You have to be able to get out of barotrauma because that's one of the issues in which you can get in trouble, right? The anatomy is different in children as they developmentally age. Their eustachian tube is shorter, more horizontal. It's immature, floppy because there's decreased cartilage. And as they get older to an adult size, that changes. But that increases their risk for inability to clear their ears. And we all know if you can't clear your ears, the risk of barotrauma goes up significantly. Last night, Chris Logue gave a nice, eloquent discussion on patent foramen ovale with illustrations. So I'm not going to go in so much detail, but patent foramen ovale for divers is something we all are concerned about, and for diving physicians. So we have, as when we are born in utero, there's a opening, a foramen, that's oval shaped that connects the right atrium to the left atrium. And after we're born, we take our first breath. Physiologically, that foramen closes. And if it doesn't close, it's called a patent, which means open foramen ovale. And the problem with that is that what's supposed to happen after we are in air, right, when we're born, with that sealed, then the right atrium and left atrium, there's no connection. But because of a connection, blood can move or shunt from the right side to the left side. And if there are any nitrogen bubbles in this right chamber, if you have a patent foramen ovale, those bubbles can go across and go into this circulation and cause all the damage that we see as decompression sickness. And so all this can be averted by having the recommendations of, in children, having them dive, or the dive profiles have what's somewhat modified. In other words, shallow and short dives to decrease the risk of bubbles. But remember that it's probabilistic, right? Going in the water, you still can get decompression sickness. Diabetes, another major issue. Obesity in the United States, epidemic. I was in France in the end of June and July, and I was probably the most obese person in the city of Paris. I never saw anyone overweight. Of course, they were all smoking cigarettes that I saw. But obesity in Europe is a little bit of a different issue. United States, diabetes, big epidemic, big problem. Children in diving, what is the risk? No significant studies have been published regarding pediatric divers that have diabetes. There was one study done in 2006 that looked at control of diabetics, and they did note that they are at increased risk of becoming hypoglycemic, and hypoglycemic, of course, could be a dangerous situation. So again, we've adopted the adult rules that scuba diving may be possible when strictly adhering to a monitoring and safety program, but it hasn't been studied and tested in children. Attention deficit. This is a significant issue. If we look at what attention deficit disorder is, attention span is reduced, hyperactivity and increased impulsivity, impaired cognitive abilities. All those things we talked about earlier, that's not what you want in the water. That's not who you want to work with. Okay? And those who have attention deficit disorder have an increased association with the DCS, increased incidence of ENT incidents. So I have my next door neighbor's kid has attention deficit. He has Asperger's syndrome, but he's a high-functioning kid. He drives a car. He goes to work, so that's wonderful. But he's instructed when he took his driving course that he's never to go over the yellow line when he's driving. So even though a child may come out and he has to turn and go like we all would, he doesn't do that. So he's up to his third car. Fortunately, he hasn't injured anyone, but his ability to clear his ears, if he was instructed to do so, he may not be able to comprehend that. Increased likelihood of traffic accidents. So if I'm having increased traffic accidents, I certainly would think that I'm going to have problems in the water as well. So what is the risk for diving injury in children? And it's very clear, at least we know that there's literature in the adult population regarding the medical risk. It's well described, but it's not so well described in the pediatric population. And if we look at sort of the literature, and this is old literature done by Smers, right? He had a 20-year experience at University of Hawaii. In total, 22 divers, age 17 and younger. The incidence of decompression illness was less than 3%. There were no deaths. And Divers Alert Network published their last data that looked at this at between 2003 and 2005, and about less than 3% of children and adolescents. And the evaluation of all these were, sort of the same thing, right? Lack of formal training, lack of experience, high-risk dives, going beyond the profile. So treatment options. So my child gets bent. What are the treatment options? Are there special pediatric tables? And the answer is no. And Smers actually looked at this and published a nice article in 2005, and he was using this similar sort of profiles in children and found that they did well, or as well as they would be expected based on their initial exam. So as a diving physician, when I'm trying to give advice and answer questions to parents and to the different diving community, I have to look at and be cautious of the physical maturity, that growth and development of that child. I also have to be cognizant of the fact that who are the parents and what is the motivation for that child to dive. Motivation is key. That child may not want to go in the water, yet they want this kid in the water because they have to be at a resort and they don't want to have to pay for daycare, whatever the issues may be. This could be very dangerous territory. Also think about the motivation of the dive shop, right? Financial gain. Appropriate gear. Now, they're starting to develop appropriate gear for different age-related people, but it's not based on the physiology of the child. It's based on sort of a height and weight proportion. Keep in mind thermal protection, all right? A 6 mil suit may be okay for you as an adult, but it may be not adequate enough for that child in that condition. So I think it's very important, understanding growth and development, that children are not little adults. Also, understanding the work demand. If I'm going to answer the question, can this child dive? What is the work demand? Where are you diving? If you're diving up on Long Island, all right, in the Sound, for example, then that may be a more dangerous situation than diving down, in the Caribbean, perhaps. All right, and can the child meet that demand? All right, go down to the Keys sounds like a great thing, except when you're at 5 foot of waves, right? Pretty dangerous. Dive safety plan. All that goes in the water, literally, when something happens, right? You're out of air. What if the adult is out of air, right? Which can happen. Is your child going to witness the death of their parent underwater? So when we look at the issue of children and diving, not a lot is known. We're making a lot of assumptions. And this is based on theoretical consideration, and we're translating what we're applying to adults into children when we already know that there are clear differences in both their physiology, growth, and development. So I think that we should really be focused on awareness to the parents, to the dive shops, and to the community. When I advise parents, should my child dive, I try and put that off as long as I can, thinking about my children and their growth and development. I have a 14-year-old and a 16-year-old, and I would not want I don't even want my 14-year-old to be in my car, much less be in the water. And so and this was from the University of Pennsylvania, the concept here, fitness to dive, right? So what is fitness to dive? And Dr. Bird had mentioned that in the very beginning of this talk. It's a combination of looking at their medical fitness. So what are their underlying medical issues? The growth and development, the physiology of the individual, young or old. What is the psychological fitness? Do they have underlying issues? Panic attacks, right? They don't want to swim, their motivation. Nutritional. Do they have some issues that may preclude or have a difficult time? Will they understand to be well hydrated? Will they actually drink before and cooperate afterwards? Are they physically fit? You know, my rule of thumb for my children is, you know, they want to dive, and I said, when you can swim a mile in water, then you can dive, because I can swim a mile, and that's my criteria, all right? Knowledge, special training, all right? Going to a dive shop that has experience and knowledge and interest in instructing children, having that open dialogue with the parents, very important, and the physical skill, okay? Physical skill is key. You know, can they handle an emergency? They're your dive buddy, essentially, right? So are you comfortable with that? How good a diver are you? What's your experience if you're going to be supervising your child? All this comes into the question of fitness to dive. And again, when we ask those questions, can my child dive, we have to consider all these variables in that equation. Right? Thank you.